This is Miss Etta Monroe. She is a total hip replacement on her right hip. Adair is going to explain what we're going to do today as far as transfers, as well as gait training and patient education. The PT asked Adair to come in for this intervention, and Adair is going to explain some hip precautions.
How are you doing, Zeta? I'm Adair. I'm the PTA working with you today. So we're going to get you to sit up. We're going to log roll, sit up, transfer you to this wheelchair, and then PT, and then come back. We have an IV in our right side and a Foley catheter, so we got to be careful of those lines. Your weight bearing is tolerated on this right leg, but we have hip precautions. So there's 3 of them. First one is we can't bend our hip past 90 degrees. Okay, so that's 90. We can't go past that. We can't internally rotate that leg, so we can't point that toe in. And we can't pull that leg in across midline, okay? Because it is a posterior approach, okay? Do you have any questions? Okay. If at any point you are hurting, you just let me know, okay? So, to begin with, I'm going to show you the wheelchair. So this is an on the wheelchair. Alright, so this is a wheelchair. We're going to lock it in and make sure the driver wheels, which are the smaller ones, are pointed forward and everything is locked in. The locks are right here. Okay, we got a pillow for comfort. Okay, so once we get you, just sit up. I'm going to put this thing called a gait belt around you. That's for my safety, that's for your safety, so we don't hit the floor. Okay? Alright, so we get you to roll. We're going to use this hand to pull. We're going to slowly roll to our side, and we're going to use the weight of our legs to sit on up. Okay? Watch those legs. Good. Alright. Sit on up. Good. Remember to lean back, but only past 90 degrees. Lean on back. There you go. Good. So, move this IV. Make sure we got slack in it. Okay.
You can also put a pillow behind the patient just in case she can't hold her body weight up, so she can lay back down on the pillow if she needs to.
Alright, so now I want you to scoot slowly to the edge of the bed. Drop that head down. Good. Alright. Now, like I told you before, transfer this chair. So by doing that, we're going to do a stand and pivot, okay? You can weight bear as tolerated on this, but still make sure all 3 precautions are met, okay? So, you can go through it. Alright, so when you're ready, we're going to stand up. Okay, 3, 2, 1. There you go. Pivot. Good, find that chair. Good. Alright. Kill it.
So Adair just transferred the patient. She used a guarding method using her left leg, guarding the patient's right knee. and that was because she, since she is weight bearing is tolerable, the patient might not expect putting that much weight through that knee, and it might be weak just because of the surgery and lack of exercise. So just to prevent that knee buckling, Adair used the guarding method.
Alright, so now we're going to put our foot rest on. Okay? So before we do that, we're going to transfer this catheter. Good, relax, relax. Don't go past 90.
So Adair put the catheter on the bottom of the wheelchair, and she is about to insert
Relax it, but make sure we're not past 90.
insert these footrests.
So by doing this, I just want to get that one up first. We find these two little holes, these two little notches out to the side. Insert them in, and then we swing this in with the bow. It'll lock it in place. See how it can't come out anymore? Okay. Good. Cut it.
All right, so Adair is going to transfer the patient back. Patient just came back from PT, and she's going to explain what she's about to do.
Okay, so now we're going to do the same precautions and everything. I don't want you bending past 90, pointing that toe in, or pulling that leg in past midline, okay? So when we sit up, I'm going to start off with putting the Foley catheter back on our bed, okay? Take our leg rests off. We still don't want to break 90, and we're going to sit, scoot to the edge, stand, pivot, transfer, and we're going to lay back down, okay?
Adair's also using good body mechanics, always bending at the knee and not at the back. So it's very, very important if you're transferring patients.
Alright, we're not past 90. So get you to scoot to the edge of the chair, walking your feet, good. Alright. There we are. We're gonna stand, we're gonna lock everything in. Okay. Good. Alright, so now we'll guard it, we're gonna stand, get our composure, and then have a seat on the bed, okay? We're not past 90 degrees though, okay? 3, 2, 1, stand. Good shit. Alright, we're gonna slowly sit down, not bending. There we go, good. We're gonna lay on our side. Good. There you go. Alright, now we're gonna roll back. There you are. Excellent. Alright. Take this belt off of this. Are we comfortable?